And good afternoon, everybody. Once again, it is Monday, not quite morning anymore, but we are going to have a chat about leadership today. And I'm ecstatically happy to have Dr. Amanda Parsons with me today. Our paths have crossed several times over the last 10 years, as I did a stint with New York City Health and Hospital. And of course, although it's a big city, it's also a small community of healthcare providers. So it is her opportunity today to kind of like introduce herself and to our audience. And then on the back end, we will talk a little bit about what her style is of it, mentoring and advising, and how we can help other physicians and of course leaders in general advance their career from doing to leading. So again, thank you, Amanda, for joining us today, and take it away. Tell us a little bit about yourself.
Well, thanks so much for having me. So my story is probably not unlike most physician executives. Very early on, I knew I wanted to be a doctor. I was very interested in emergency room medicine, and I was 100% dead set on being a doctor. I went to medical school, really enjoyed medical school, and it only furthered my desire to be a physician. I got into medical school. I was actually originally slated to go to UPenn. And over the summer, I was going to spend some time being an EMT, which I had done in the past. But I thought, it would also be good to just get a real job before I now plow myself into the next decade of medical training. But I got a job working for a fantastic woman at a contract research organization, working on organizing clinical trial data in advance of FDA submissions. And while it wasn't anything that I was ever going to be like lifelong passionate about, it introduced me to the concept of like the office and how people work together in teams to achieve important strategic results. And I remembered that experience and how much I loved being a part of that, how much I loved understanding all the different parts of the projects that we were working on. And my boss at the time was very gracious. And even though I was a summer intern, she gave me a lot of exposure to our clients and to the very senior level meetings, far above my pay grade. And it really just whet in me an appetite for understanding health systems and also working in like more of a team-based environment. And so I had a chance to actually defer my admission to medical school and spend another year at the organization, which I really loved. And it gave me a chance to pause and say, okay, is this so interesting that you might want to no longer be a doctor? And it was not. I really felt strongly that I wanted to go back and pursue medical school. But already this little flame of like the business mindset had been ignited. So I started my first 2 years in medical school and eventually made my way over to the MD MBA program, where people who had that kind of gnawing feeling that you maybe want to do more than just the direct practice of medicine. Thankfully, Columbia, where I ended up going for medical school and doing my dual degree, had a very welcoming program for medical school students. And so I was able to do that. And that took me completely outside of my healthcare milieu into a training in management. And I got a lot of good career coaching in business school that helped me understand that a role in consulting might be one of my possible future states. And so I took a summer job at McKinsey & Company as a management consultant in the healthcare field and was really intrigued by that work and decided to accept my offer to return to them full time after business school. It was still tricky because at the time I had, I'd finished up my medical school training and had really loved the idea of being an ER physician. And that's what I would have done in my alternate universe. But this world of consulting was spoke a lot to me and the way that I like to work, high-paced, team-based environment. And so I did some years at McKinsey. I took a sabbatical to go back and do my PGY 1 year, in part because I was curious about the world that I had left behind and thought, well, maybe there was more on the table. I should have pursued being a doctor, also to, be able to have, to be a licensed physician. And I really enjoyed my time on the floors back. I asked to be treated as a categorical. I had a clinic. But ultimately, I was driven to a decision of like, do I go back and stay in medicine, or do I go back to the healthcare system work that I was doing? And I ended up deciding that that was a better fit for me. And so I gave up, pursuing the practice of medicine, but stayed the whole time in healthcare. I had a chance to work for the Bloomberg administration, doing 7 years of public health work, including overseeing the healthcare of Rikers and other large health department projects. I then went over to Montefiore Health System to work more in the community and population health space. And I really enjoyed that lens of being at a health system. And then ultimately said, one of the things I really don't have as part of my multifaceted picture is the lens of the payer. And even though Montefiore had been a very risk-bearing entity, it still was different than being at a health plan. And so I had an opportunity to become the Deputy Chief Medical Officer at Metro Plus, where I spent several years overseeing care management and being a director, and really enjoyed it. And just, over a year ago, had an opportunity to do it at a larger scale at Health First, another New York State-based payer, and have been doing that ever since. And so my road has been, it had vast swings in the beginning, and then over time, those swings between like clinical and business became smaller and smaller, to the point that they're now essentially a singular path.
So thank you for sharing that. And again, that's the value that you and others can bring, because everybody has their own path, right? And one thing is that we start off with, what is my big dream? Well, listen, if you have a big dream, but you don't take little steps towards that big dream, you'll never get there. And over time, you will find, and fine tune what your true passion is. And on the end of the day, I believe that, your goal is to make it a better experience for the patient, to give safer, higher quality care. And I think that's the common link that we have in healthcare, and is certainly for all the physicians I've spoken with and other clinical care providers. It is about the patient, and so thank you for sharing that. So this is a quick follow-up question. So you mentioned mentors along the way. So again, I believe that after having spoken to dozens of people, that the gap between people who are clinical to and doing positions to go into a leading position, your MBA, MPAs, things like that are helpful because you have a better understanding of the business world. But it still doesn't really help you become that more effective leader of people, because as a physician leader, it's not just leading other doctors, it's really, leading a multidisciplinary team. How did you, where did you find the support, and how would you classify mentorship in your journey as well? How relevant was that? How important was that to you?
So I would say I was very lucky to have had a number of both formal and informal mentors who helped shepherd me along the way. In part, one of the biggest things they did was validate the vicissitudes that I was, feeling that they made it okay that you weren't like abandoning one field to go do the other. And, and just that commonality around a lot of people experience this difficult time finding the place that really speaks to you in this vast healthcare arena. Especially if you're coming at it, I graduated from medical school in 2003. At the time, the world was, a little, when we had Palm Pilots, that was like our tech enablement. It's a completely different world than it is today in terms of all of the different potential startups. And having come from a pretty traditional, education, you tend to put in place these unnecessary blinders. Like they don't exist, but you think that they do. And I think the role of mentors is to like help you peel apart those blinders and to say, no, you can cast a wider net. You can go work at a law firm. You can go work at a bank. You can go work, you can do these things. Like it's not just this traditional, go to pre-med, then med, then, then your internship and residency, et cetera. And so just that permission to step off the track and create your own path was extremely helpful. And then just people who help elevate you in your path. I think that there's a lot of times that you want to, you're trying very hard to be successful in your role, but there are rooms where the discussion happens. And it's important to be in those rooms. But those rooms tend to be filled with the same people who've always been in those rooms. And it takes a special kind of person that says, hey, I'd love for you to sit on this. Come with me to this discussion, or let me invite you to this. There were many times where I would be one of the only people in her 30s at a table of people who were much more senior than me. And just somebody put me at that table. Somebody let me be at that table. Somebody thought to extend an invitation. Somebody said yes when I asked if I could be at that table. All of those people who create that shorter path between you and the real conversation that's happening around healthcare design, healthcare reform, et cetera. I think those opening those doors and placing those seats at the table, I think has been an important thing that mentors have done for me, and what I hope to do for others, which is, open up your Rolodex, make the introductions, think about, the room where it happens and how you can bring other people into that room and into that conversation, and really support people in their quest to shine their natural glow.
Yeah, and exactly that's that second, part of it is the pay it forward. As we mature, not in age, of course, but the maturity of wisdom, and how is it now our turn to do all the things that were done for us, and we can never forget that it is up to us now to open up the doors. And I still find that too many executives get busy and they forgot how they got there, right? And that's something as a physician advisor to our academy coming up with the students, and it is that how do you see yourself? And in your current everyday practice, how are you opening up doors and making sure you stay true to the words of what you experience, and of course improve upon it, right? That's our goal, is always to make it a little bit better. So tell me a little bit about how do you do it in your current practice to make sure that you create opportunity for the people around you?
So it often starts with having a very intentional process for meetings and projects. Who needs to be at the table? So who are the fan favorites, right? You need the analytics guy, the IT person, this person, the people who are there from their operational necessity. But then who else would benefit from the conversation? Maybe who is the person who either works for you or somebody else, where you can say, it'd be great if you could bring that person to the meeting. And really, I feel like if you don't set the intentionality, like you said, everybody's super busy. We go to meetings all day long, and it's very hard. It's not fair to people if at the last minute you're like, oh my God, just thought of you. Could you please join this meeting? Although often, sometimes it does get down to that, and often people will still say yes, even though it's last minute, just that's how badly they want to be included. But I think really intentionally setting up the dialogue with part of that frame in mind, who do I need to be successful, but then who also needs this meeting to be successful, and how does that align with the people that you're mentoring? I think the other is just, as you mentioned, despite busy schedules, carving out the space, when somebody says, hey, will you mentor me? It's a really high bar to say no. For me at least, it's just even if I think, oh, I'm really busy, or I don't know, I don't really know this person all that well, what could I possibly add to their life? I just say yes. At some point, maybe that will stop. But for right now, I just say yes, because you never know. First of all, if you don't know people, they know more about you than you know about them. They've sought you out. And why not spend time getting to know? I've never regretted saying yes to being a mentor. And I think lastly, the other thing is just trying to flatten out the organization and welcome other points of view and feedback. And I know at my current organization, one of the things that I've underutilized in other places has been the meeting chat, and just encouraging people to put their reflections in there. We sometimes do these large, all staff meetings. It's several hundred people on the call. Not everybody's going to feel comfortable raising their hand and asking a question, but we invite commentary, good or bad, on the side. And then often some follow up with those people. If somebody said, hey, I see what you guys are talking about. Have you guys thought of X, Y, and Z? I'll take a screenshot of that. I'll write that person's name down and reach out to them and say more about that. So it's sort of like let them, even like the faintest little bubble that they want to be on your radar screen, take the opportunity, because often what's lying beneath is just a wealth of, practical boots on the ground experience that can really help shape the larger strategy.
Yeah, it is about giving everybody a voice. And I always, in my project management, is that you have subject matter experts and key stakeholders. But sometimes the words is you want fresh eyes. And you refer to that without saying the words. That's where you have people bring in last minute or planned that can really add value by just listening to things for the first time. And they can certainly sometimes bring things from a different perspective. As my kids, they're ranging from 32 to 16. Hey, listen, technology to them is very different than as a young 50-something-year-old, right? But they can add value to a lot of the conversation because they know things that are natural to them that are kind of foreign to me. So, but Amanda, thank you for the really good conversation. Any parting words to a future student, or the reason why somebody should take that leap and join an academy and be mentored?
I would say that there are a wealth of people out there who would love to meet you and help you think about the choices that you have in front of you, and maybe others that you don't even know about. Help be a sounding board for how to present yourself, how to negotiate something, how to fit into roles that may on paper not make it seem like you're not a good fit for them. But there's always a way to take the story and figure out how you can massage your way into these roles. And I think that's also another place that I feel like I benefited from mentorship, and something I love doing with folks. So really excited for folks who are considering the mentorship model. It's definitely highly worth it.
Excellent. Thank you very much. Have a wonderful day, and we'll certainly be connecting in the near future. Thank you.
Okay. Good. Thank you. Take care.
Take care.